An estimated 46% of adults with hypertension are unaware that they have this condition. It is a major cause of premature death worldwide. So this brings us to our topic, blood pressure. This is the Lab Doctors channel. I will entreat you to subscribe to this channel, like, comment, and share. You can also follow us on TikTok, Instagram, and then Twitter at the Lab Doctor. Let's do this together. Blood pressure is simply the pressure of blood pushing against the walls of arteries. So blood pressure is measured in two denominations, that is a systolic and then diastolic. Systolic measures the pressure in your arteries when your heart beats, and then diastolic measures the pressure in your arteries when your heart is at rest in between your heartbeats. Let's look at the reference interval for blood pressure. Reference interval for blood pressure varies from facility to facility. So normal range for blood pressure is 100 to 110. That is for systolic. And then diastolic is 60 to 80. We have pre-hypertension. That is when you are on the borderline. And systolic is from 120 to 139, and that of diastolic is 90, and then from 140 and then above. That is when you are diagnosed to be hypertensive. Your body blood pressure changes during the day based on the activity you involve yourself. But if you consistently have your systolic blood pressure and then your diastolic blood pressure being higher than normal, then you attempt to be hypertensive or you attempt to have high blood pressure. The higher your blood pressure level, the more you are at risk of other health issues such as heart disease, heart attack, and then stroke. So let's come to signs and then symptoms of blood pressure. So pre-hypertension or developing high blood pressure has actually no signs or warning symptoms. You will only get to know when you check your blood pressure consistently. But high blood pressure has these symptoms. Some of the signs and the symptoms of high blood pressure. We have dizziness, we have anxiety, we have confusion, we have headache, we have chest pain, we have nausea, and then we have vomiting. These are some signs and then symptoms of hypertension. So let's look at causes of hypertension or high blood pressure. Unhealthy health choices like not engaging in regular exercises, eating too much fat, it puts you at risk of getting hypertension. The next one is diabetes. If you are diabetic, you are of the risk of developing high blood pressure. Pregnancy prones you to high blood pressure. And then obesity. If you are not able to control your weight, it puts you at the risk of getting high blood pressure. Let's look at complications that hypertension can bring to you as an individual. High blood pressure can cause a lot of damage to your heart and other vital organs in your system, such as your brain, such as your kidney, and also your eyes. Let's look at blood pressure and then heart attack. How does high blood pressure lead to heart attack or heart diseases? This is what happens when you have high blood pressure. It damages your arteries by making it lose its elastic property, which therefore decrease the flow of blood to your heart and then to your brain. By so doing, you may experience severe chest pain and then heart attack. It may also lead to heart failure, and then stroke. These are some complications that high blood pressure can put you through. Okay, let's look at how high blood pressure brings about stroke. So, high blood pressure can cause your arteries that supplies oxygen and then blood to your brain to be blocked, or it can burst, which therefore can lead to stroke. Brain cells and other cells within the body can die during stroke because they do not get enough oxygen. Let's look at how we can manage or prevent high blood pressure. We should do as much as possible to change our lifestyle by doing regular exercise, eating a lot of fruit and then vegetables. Let's try as much as possible to reduce the intake of oil and then fats. Let's also do as much as possible to take in balanced diet. It's very, very important. Let's try to control our weight. Let not encourage smoking. It is very detrimental to our health. We are also advised to take our medications that are prescribed to us by our health practitioners. These medications will go a long way to help us prevent some other adverse effects such as cardiovascular diseases, stroke, and then many other more. Please, if you have these kind of conditions, you are advised not to do self-medication. So I will entreat each and every one of us to be proactive about our health. Let's check our blood pressure regularly. This is not expensive. If you walk into any facility and then ask of health practitioner or a nurse to help you know your blood pressure, it's not going to cost that much. At least get to know your blood pressure level, and let us heal to management and then preventive methods to help us stay healthy for ourselves, for our family, and for Ghana, our motherland. Kindly subscribe to the Lab Doctors channel, like, comment, share, and please you can follow us on TikTok and Instagram and then Twitter. Till we meet again. Bye bye.